Okay, so have you ever been completely taken out by something?
Yeah.
Just ridiculously small.
Oh, all the time. It's like the universe enjoys a good practical joke.
Right, like tripping over absolutely nothing, or, you're about to give this killer presentation, everything's set up, and then you realize one tiny stupid cable isn't plugged in.
And the whole high-tech setup just dies.
Yeah,
Total more down from a speck of dust, essentially.
exactly. And honestly, nothing feels more like that than sudden back pain. You bend down for like a piece of lint, and bang, it feels like somebody just, I don't know, embedded a knife in your spine.
Yep. That feeling of utter betrayal.
Yeah.
You did nothing epic, yet the pain is legendary.
Totally. You're thinking, okay, I must have shattered something major in there.
But the wild part is, the scale of the pain almost never matches the physical scale of the actual problem.
What do you mean?
Well, there's research showing just how incredibly sensitive those spinal nerves are. Get this. It only takes about 0.2 millimeters of pressure on one nerve to cause major, debilitating pain.
Hold on, 0.2 millimeters. That's like, what, 2 sheets of paper thick?
Exactly. 2 pieces of standard printer paper.
You're telling me the difference between me walking around fine and me screaming on the floor is the thickness of 2 flimsy pieces of paper.
That's what the science suggests.
Yeah.
And that tiny bit of pressure, it can crank up your perceived pain by as much as 40%.
Wow. Okay, so you feel like you tangled with a rhino, but really you're just missing that tiny sliver of space.
Precisely. It's all about that space.
Unbelievable. Right, so that's our mission for this deep dive then. We need to figure out why our oh-so-modern lives, our comfy chairs, cars, slouchy couches, are basically conspiring to steal that crucial 0.2 millimeters.
The space thieves.
And then we got to talk about the simple, maybe slightly weird anti-gravity fix that might just reverse years of being squashed. Okay, let's unpack this.
Let's do it. And we have to start with, well, the great ergonomic lie. The office chair.
Ah, yes, the throne of modern suffering.
Right. Most people think, oh, standing all day must be way harder on my back than sitting.
Yeah, that makes sense. Sitting is resting, right?
You'd think. But the data, it clearly shows there's actually more pressure on your spinal discs when you're sitting, especially if you're slouching, which, let's be honest.
That's pretty much standard operating procedure for most of us.
Yeah.
So the comfy chair is a betrayal.
It can be the ultimate spinal villain, yeah.
Okay. And it's not just the sitting itself, right? It's how we sit staring at screens.
Exactly. Think about that posture. Head drifting forward.
I always think of my head like a bowling ball. It feels about that heavy sometimes.
It basically is. And for every single inch that bowling ball, your head creeps forward past your shoulders. You're adding about 10 pounds of extra stress. 10 pounds. To your neck, your upper shoulders. Eventually, that load travels right down to your lower back.
10 pounds per inch. And people do this for hours.
8 hours a day, maybe more. Those tiny 0.2 millimeter gaps, they just don't stand a chance against that kind of sustained pressure.
Man. And life just keeps squashing us, doesn't it? Like you start the day sitting in traffic.
Often reversing that natural curve in your lower back.
Yeah. Then you get home, exhausted, and what do? Collapse onto the couch.
Which is usually like the absolute worst surface for keeping your spine happy.
Yeah.
Terrible alignment.
Right. And then, just for fun, throw in aging.
Oh, yeah. We literally get shorter. The space between the vertebrae shrinks over time.
So it's like a perfect storm of compression.
It really is. All this decreased space, day after day, year after year. Eventually, something's got to give, whether it's a disc bulging out or arthritis setting in or scar tissue forming.
It hits those nerves. That 0.2 millimeter threshold is breached.
And boom, chronic low back pain. It's fundamentally often a space problem.
Okay, so gravity and modern life are basically trying to turn us into human pancakes.
Deliciously compressed.
So the fix, it has to involve fighting back against physics, right? This is where it gets, really interesting, the anti-gravity stuff.
Exactly. Decompression is the name of the game. And no, you don't need to book a flight to the International Space Station.
Oh.
No, we can just use a simple inversion table to essentially reverse the flow of gravity on your spine.
Okay, explain that. Because if I hang upside down, isn't all the pressure just going to go to my head and neck? How does that help my lower back?
That's a really common question. It does seem a bit counterintuitive. But when you invert, even partially, you flip that gravitational force.
Right.
So instead of your upper body weight crushing down on your lower back discs, the weight of your torso, your head, your arms, it actually pulls away from your lower body. It creates negative pressure or traction in the lumbar spine.
Okay, like stretching it out from the inside?
Pretty much. That force helps pull fluids and nutrients back into the discs, increases blood flow, and crucially, it can gently break up some of that old scar tissue or adhesions that might be clamping down on those nerves.
And the cost thing is kind of hilarious when you think about it.
How so?
Well, an inversion table, what, like $100? Maybe $400 for a fancy one.
Yeah, in that ballpark.
That's often the price of one single session with a physio or a chiropractor or a specialist doctor visit.
It's true. The cost comparison is pretty stark.
You can basically buy yourself unlimited, at-home, anti-gravity relief for less than a couple of copays sometimes.
It is remarkably cost-effective.
Yes.
But, and this is a huge but.
The serious part. Safety first.
Absolutely critical.
Yeah.
We have to put this warning out there very clearly because you are messing with gravity and blood flow.
Right. Head below the heart.
Yes. So if you have uncontrolled high blood pressure or glaucoma, that's high pressure inside your eyes, or any history of heart problems, you must talk to your doctor before even thinking about trying this.
Seriously, don't skip that step. Talk to your doc.
It's potentially life-saving advice. No fooling around with this one.
Okay. Duly noted. So, assuming you get the green light from the doctor, you can't just hop on this thing and hang like Dracula for an hour, right?
Definitely not. No, no. There's a process, a protocol. You got to ease your spine into the idea of being, well, longer.
How slow are we talking?
Very slow. Like first week, just 1 or 2 minutes max. And only at a really shallow angle, maybe 15, 30 degrees. That's it.
Okay. Once or twice a day.
Once or twice a day is perfect. Just letting your body get used to the sensation.
And then what? Start cranking the angle up?
Gradually. Over the next week or two, maybe work up to 5 minutes. You could try going a bit steeper, perhaps around 60 degrees if that feels okay.
All right.
But here's the really key part, and this relates back to just static hanging versus doing something productive.
Okay.
You want intermittent traction, not just hanging there like a side of beef.
Wait, intermittent? Why? I thought the goal was to stretch it out. Wouldn't holding it longer be better?
You'd think so, but we're dealing with living tissues, discs that need fluid exchange, ligaments. Static hanging can be okay, but cycling is better.
Cycling? How?
You invert for maybe a minute or two, then come back up to horizontal, pause for 30 seconds or a minute, then invert again. Repeat that cycle.
So it's like a pumping action.
Exactly. It creates this dynamic pumping effect for blood flow and fluid in the discs. It seems to be much more effective for healing and getting circulation into those tight spots than just hanging statically.
That actually makes a lot of sense. It's not just passively stretching, it's actively stimulating the area.
You got it. So after maybe 3 or 4 weeks of this gradual buildup and cycling,
Yeah.
your body should be pretty well adapted. Then you could potentially go to nearly full inversion, still using those 1 to 2 minute cycles, maybe for a total of 15 or 20 minutes.
How often?
Probably just 3 times a week would be plenty at that intensity. And people often say they genuinely feel taller right afterward.
I bet you've literally stretched yourself out. Okay, so we've tackled the mechanical squashing, we fought gravity, but what if the nerve is still angry because of, like, general inflammation, not just being pinched?
The slow burn, yes. Inflammation is the arch nemesis of chronic pain, period.
So decompressing isn't enough if your whole system is, like, inflamed.
It helps, but you got to address the inflammation systemically too. And the biggest lever there, surprisingly to many, is diet.
Diet? For back pain?
Absolutely. If you're battling chronic back issues, seriously considering a low-carb ketogenic approach can make a profound difference in lowering inflammation throughout your entire body.
Wow. That feels like a big leap for back pain, but I guess inflammation doesn't just stay in one place, right?
It's everywhere. And another huge related thing, getting rid of omega-6 seed oils.
Seed oils, like vegetable oil.
Yeah, think corn oil, soybean oil, canola, safflower, sunflower.
Mm-hmm.
They're in everything processed.
Okay. Why are they bad for my back?
Because they're highly inflammatory, and they directly compete in your body with the anti-inflammatory omega-3s, like from fish oil, if you're overloading on omega-6.
You're basically fanning the inflammatory flames even if you're taking omega-3s.
Precisely. It's like trying to put out a fire while pouring gasoline on it. Doesn't work well.
Got it. So, cut the processed carbs and sugars, ditch the seed oils. Yeah. What about supplements? Anything specific for the back?
Oh, definitely. The number one deficiency we often see linked to chronic pain, especially lower back pain. Vitamin D.
Really? Vitamin D?
Yep. Sometimes weakness or aching in the lower back is one of the very first signs you're deficient. and you often need a hefty dose to correct it.
How hefty?
We're talking potentially 20,000 to 30,000 IU of vitamin D3 daily for a period to get levels up. Critically, always take it with vitamin K2. They work together for calcium placement.
Okay, D3 with K2. What else?
Magnesium, absolutely essential. Around 400 milligrams of magnesium glycinate is great. It helps with muscle relaxation, nerve function, hundreds of things.
All right, D3, K2, magnesium. Good trio. Now let's swing back to movement for a sec. What about stretching? You mentioned regular side bends don't always cut it.
Right. For that deep, sticky lower back and hip tension, you need to get into the myofascia. That's the connective tissue web holding everything together.
Okay.
Just bending straight sideways. That mostly hits the surface muscles. To get deeper, you need to think. Spiral.
Ah, this is the wet rag thing you mentioned.
That's the analogy. Think of your torso like a wet towel. If you just bend it, some water comes out.
Right.
But if you twist it first and then bend it, you wring out way more water, right?
And totally. Okay, so how does that apply to stretching?
When you do a side bend, don't just lean over. Lift the opposite arm straight up overhead,
Right.
reach high, and as you bend sideways, add a slight rotation away from the bend. Feel that deeper pull.
Ah, okay, so it's arm up, reach, bend, and slightly twist away, using the whole body to wring out that tension.
That's the idea. It gets into those deeper fascial layers much more effectively.
Cool. Okay, final stretch here. What if someone can't afford an inversion table, or like we said, they have a health reason they can't use one? Are there any zero-cost anti-gravity hacks?
Absolutely. There are some great ways to get passive decompression without hanging upside down.
Lay them on us.
First, a modified child's pose. The yoga pose.
Yeah.
Okay, grab some rolled up blankets or firm pillows, stack them up, then kneel and lay your torso over the stack so your belly and chest are supported, but your lower back can just drape and relax. Gravity is effectively eliminated in that specific spot.
Ah, so you're just creating space passively by letting it hang supported.
Exactly. It can offer really significant immediate relief just by taking the pressure off. No investment needed.
Love a free hack. What else?
The classic legs up the wall stretch.
Okay.
Lie on your back, scoot your butt right up against a wall, and just rest your legs straight up the wall.
Okay.
If you can, maybe slide a small pillow under your hips to elevate them slightly. This uses the weight of your legs and that slight hip lift to create a very gentle, passive traction on the lower back.
Nice and easy.
You can also achieve a similar effect lying over a large exercise ball, letting your spine curve over it.
Oh,
And finally,
the most relaxing one.
probably water therapy, just floating, in a pool, in a lake, even a bathtub if you can manage it. The buoyancy of the water naturally reduces the gravitational force on your spine.
Gentle, gradual decompression. Makes sense.
It's surprisingly effective, especially for managing flare-ups like sciatica without needing any equipment at all.
Okay, so wrapping this all up, it sounds like we live in a world that's actively trying to squash us, literally.
From our chairs to our food choices, yeah. The pressure's on.
But fighting back doesn't necessarily mean crazy expensive treatments or surgery. There are simple things, accessible things, low-risk things we can do to reclaim that vital, tiny bit of space.
That's the core principle, really.
Yeah.
Increase the space, even by that minuscule 0.2 millimeters, and reduce the inflammation.
Right. Whether it's using anti-gravity tricks, changing the oils you cook with, making sure you're not deficient in vitamin D, it all points back to calming those nerves down and stopping the squeeze.
Stop a squeeze, calm the fire. That's the goal.
You know, we spend our whole lives being compressed by gravity, bit by bit. The idea that just reversing that flow, even for a few minutes, a few times a week, can actually start to undo some of that, make you feel taller. It's kind of profound.
It can make a real difference over time.
So maybe the final thought for everyone listening is, what essential part of your body are you just letting physics slowly crush day by day? And what's one small, maybe even slightly radical shift you could make, like starting tonight to begin reversing it?
Maybe just finding a wall and putting your legs up for 5 minutes instead of slumping on the couch.
Exactly.
Yeah.
Ditch the slouch. Find a wall. Small steps to feeling taller.